This is the Bartholomew Town Podcast.
Hey, everybody. Welcome into another edition of the Bartholomew Town Podcast. It's Bill Bartholomew here with you for new episodes every Tuesday and Thursday. And whenever breaking news happens at ripodcast.com or wherever you like to listen to shows. Today, we continue our look at public health in Rhode Island through some different lenses. Obviously, COVID and the hospital merger have been the dominant topics when we talk about public health here in the state. But there's so much going on, and there's so much interesting and important information to get out there that over the course of this season 5, I'm going to continue to highlight different aspects of our public health infrastructure that kind of fall through the cracks. Earlier this week, we had Lifespan on, who talked about a program that they have developed which basically takes underserved populations and gives them the opportunity to become nurses and serve in other high-level capacities inside the healthcare system. Today, we welcome Dr. Marty Nager, representing the Dental Lifeline Network here in Rhode Island. This is such an important program, and I'm sure for many of you, either you yourself or someone that you know could very well benefit from this particular program. And it also shines a light into a corner of public health that is, quite frankly, not discussed enough, and that's oral health. So a great opportunity to have Dr. Nager on to discuss the Dental Lifeline Network, what it is, where it started, where it's going, and some information about how you or someone that you know may be able to get involved. Remember, you can follow me on social media, Twitter, Instagram, TikTok, Facebook, even LinkedIn for daily digital content, breaking news here in Rhode Island, and much more. Just search at Bill Bartholomew on your favorite social media platform. Okay, let's get right to it today. Dr. Marty Nager talking about the Dental Lifeline Network here on Rhode Island's podcast of record, B-Town. The Dental Lifeline Network, I mean, that is that resonates with me as someone who went almost a decade without health insurance when I was a musician in New York. And I'm sure many other people as well. Just the notion of just the term itself, it's kind of like, wow, that is a real necessity. That is a real problem and a real gap in our healthcare infrastructure for many people. I guess talk about what the network is, your role in it, and why this is such a critical thing for so many people.
Great. And Bill, thank you very much for having me. So back in about 1985, back in Denver, Colorado, they started the organization called Dental Lifeline Network. One of the things that does is it has a program called Donated Dental Services, which again is at 30 years later is now in all 50 states in the United States. We started our program in Rhode Island in 1989, and in the past 30 little bit plus years, we have treated over 3,200 people, and we've just surpassed $7.7 million of completely free dental treatment for the elderly, the disabled, both mentally and physically, as well as people who are medically compromised. And so we have had, over the 30 years, over 460 dentists in Rhode Island volunteer for the program, and 25 dental laboratories. To date, we have 200 dentists who are volunteering, as other dentists have retired and moved on. As it turns out, for Rhode Island, the smallest state in the country, we have the absolute highest percentage of dentist volunteers of any state in the United States. The average state has about 17% of dentists that volunteer for our national program, and we are about 50% of the Rhode Island dentists that volunteer to treat the patients of the Dental Lifeline Network.
That's impressive. I mean, it's obviously a humanitarian operation. Is there, is it basically just for the good of the people that people in the dental field are getting involved in this? Is that kind of the only reason there's no ulterior motive? Is it too good to be true? What is it?
No, actually, it is good to be true, and as it turns out, when I'm trying to stand up in front of a meeting and get some dentists to help and volunteer, one of the things I say is that if somebody asked me to help build a house, I would write a check. I'm not a carpenter, I'm not a plumber, I'm not an electrician, I don't have those skills, and all I could do would be to donate to building that house. People who have dental needs, and then oral health care is extremely important, not only for your teeth, but your mouth is part of your body. And so if you have infections of your teeth or infections in your gums, chronically, it goes to your heart and your brain, and it's, flowing through your whole body. And so what I say to the dentist is, if somebody has a dental issue, who can treat these people? Doctors can't treat them, nurses can't treat them, pharmacists can't treat them. So the only people that can help people with their dental issues are dentists. And so the way the program works is we've got these 200 dentists, and that number changes a little bit every day, depending on the situation. But we ask them to take, one patient a year. And the beauty of our program is there is no clinic, there are no foreign places to have to go to and use different equipment. The clinic is basically the dentist's own office. So once a patient applies for the program and gets accepted, they just basically go to the dental office just like every other patient does. No one would know the difference, and that patient is seen by the dentist and treated just like every other patient. Whatever the dentist decides to do, it's not just taking teeth out and replacing them with dentures, which would be the least expensive thing to do. In fact, we do the opposite. We do treat the patient just like they had unlimited funds. And so we do gum treatment, and we do bridge work and partial dentures and even dental implants for patients. And that patient goes into the dentist, they get their work done. And they just go to the front desk, and instead of instead of paying at the front desk, they just walk out the door, and the dental office writes down the amount of volunteer treatment that they got. So at the end of the treatment, the dentist just sends in a postcard and says, I saw this patient and we did, crowns and bridges and implants or whatever else. And the amount of the treatment was $5,250. And then we just add that $5,250 to our $7.7 million. And that's how we got to where we are today.
It's fantastic. I mean, what does this say about the state of public health as a whole in your mind, that such a program is necessary, but then how does it inform where public health could go, I suppose?
Well, yeah, I mean, the problem is that, medicine and dentistry somehow or other separated it, many, many years ago. And so people who would have medical insurance that has nothing to do with dentistry, that's why they have dental benefit plans or dental insurance. People who are elderly who are on Medicare, Medicare really doesn't have any dental component at all. There are some new Medicare Advantage plans that have a small amount of dental work that might be able to be done, a couple of cleanings and some x-rays. But other than that, there really is no place for someone to go who doesn't have the funds to be able to have dental work done, despite, again, the importance of oral health with regard to overall health. If someone goes to the Department of Health website in Rhode Island, they could look up something that's called dental safety net providers, and there is a list of safety net providers. There are clinics where they do dental work at reduced fees, but we are someone where, again, there's no clinic. You just go to the dental office, you get your work done, and all the patients write a lovely letter afterwards, just thanking the dentist and the office for what they do. The patient feels great, the dental office feels great. Everybody it's a win-win situation. And like I said, the dentist doesn't have to leave their office, so it works out great. It would be better if there was more of a public component for dental health. I've been involved in dental politics now for over 35 years, and there is an oral health commission at the Department of Health. And, again, they have been meeting now for over 35 years and still not been able to sort of, get Medicaid and get other dental plans in place where low-income people have a place to go. That's just never kind of come off the track. And unfortunately, it's very, very expensive to be in and run a dental office, and the Medicaid fees for people who qualify for Medicaid, the fees are so astronomically low that a number of years ago, I did treat Medicaid patients, and when I realized that it would be less expensive for me to treat them for free than to have to deal with the Medicaid system and the reimbursement system and all of that paperwork that needs to be done that gets bogged down by the government. So that's sort of where this program came from. For people who are elderly, disabled, or medically fragile, they can apply to this program and literally just get the treatment that they need without having to go through all of those hassles. So the lack of dental care for all people has been and will continue to be an issue for Rhode Island and certainly for the whole country.
So I got a ton of feedback from a lot of you after our conversation with Pure Vita Labs earlier this month about cannabis testing in Rhode Island and the lack of a sophisticated and accurate labeling system for cannabis products. So I'm excited to announce that we're going to take this many steps further, and B-Town, in partnership with Pure Vita Labs, will present a monthly series, Inside RI Cannabis. It'll be here on the Bartholomew Town podcast every single month, addressing all sorts of major questions surrounding the cannabis industry, medical cannabis, and much more. Inside RI Cannabis, presented by Pure Vita Labs, every month right here on Rhode Island's podcast of record, B-Town. Remember, you can support the independent journalism, opinion, analysis, and entertainment that B-Town provides for as little as $3 per month by heading to patreon.com/BartholomewTown, or just click the support link wherever you're listening right now. You'll become a B-Town insider and receive exclusive monthly content, and you'll be helping to sustain this independent program. Patreon.com/BartholomewTown. Now back to B-Town. No question about it. And I mean, look, we have good programs here in Rhode Island, like or operations like Thunder Mist comes to mind, for example.
Yep.
But that's, the connection from certain people to a facility or an operation like Thunder Mist, that pipeline there are organizations that do that. If you're in Newport, it's the East Bay Community Action Center. It could be anything around the state. But I suppose from your perspective, messaging is quite important in terms of just getting the word out. So that's what we're doing today. I guess on a specific level, what's your message right now to somebody that may be listening, that either themselves or someone they know, someone they care about, or someone in their community is disconnected from an opportunity to have the type of oral health care that you've just described? How do they get involved on a very specific level? Is there an 800 number to call, or how do they do it?
So actually, the easiest way to do it would be just to go to the internet, and the website is dentallifeline.org. And if they just went to dentallifeline.org, all the 50 states are there. They could just click on the state of Rhode Island and get all the information they need. They can apply online. They could download an application. If they don't have that, facility, we could fax them something. And once they apply to the program, they will hear as to whether they qualify or not. They do need to put in some financial information in order to qualify for the program. At this point, we have about 50 people on the waiting list. So one of the things I wanted to impart to anyone listening is that this is not for emergency care. Again, like I said, there are 50 people on a waiting list, and as the cases get completed, the dentist will take on a new patient. So what's most important for me is to be able to try to get as many dentists involved as possible. And so that's my other hat, aside from trying to get the message out to the public that there is a program available to them. I'm also trying to get the message out to the dentists that joining our program and treating at least one patient a year would be a very important way to be able to try to deal with this problem. The other thing they could do is to call our local number, and that is 401-821-8656. Our coordinator's name is Matt McLaren, and that number is 401-821-8656. And he could direct them either to a website or send them out an application.
My last question is, based on your experience with this program, what can other aspects of public health learn? Obviously oral health is vital and critical in so many levels, obviously from a systemic human system basis, also from a morale standpoint, which can lead to employment opportunities and general life experience opportunities. I think you can make an argument that other things, whether you're talking dermatology or any aspect of medicine, could fall into this type of program. I'm not sure if they exist. I didn't research ahead of time, so I may be way out of line, and this may already be well underway. But assuming that they're not, what's your message to other aspects of public health about how they can create similar programs for those in need here in our community?
I'm not sure that I would be the appropriate person for that, since this is a very, very large organization that we've become. We've just celebrated nationally $500 million. That's $500 million in donated dental care to over 165,000 people. And so, that is something that didn't just happen overnight. It has taken many years. The thing about dermatology and ophthalmology and all the rest of that stuff is that they are all really under the umbrella of medical care. And there is a big, thick line between medical care and dental care, even though, like I said to you earlier, that the mouth is part of the body. And so, going to the State House, in fact, we get no funding from Rhode Island State House for the legislature whatsoever. Our funding is all from donations, both by our dental members and by our sponsors and donors. That's what keeps the program going. Even though the treatment is free, there is still significant expense in terms of being able to coordinate all this and using laboratories and specialists and having our dental coordinator who is salaried. And so there are places, like I said, Medicare, for most of the physicians, they take Medicare. And so if you have a dermatological problem, whatever else, there is a place to go. Getting into an office that doesn't have a waiting list is an issue, especially nationally and in Rhode Island. But specifically, since dentistry and medicine really have been different, this is specifically a dental organization that is trying to address the needs of people who have the great need for dental and oral health care that really have nowhere to go. The emergency room doesn't help, and the other, like I said, Medicare doesn't help. So there had to be a place for people to be able to go and get this treatment. We talked about some medically fragile people. I can just give you a brief example of someone who was retired, worked at Benny's their whole life, and basically is living off of Social Security at this time and needed a kidney transplant. So when they were trying to get the kidney transplant, the doctor looked in their mouth and said, look, we can't put you on the list because your mouth is all infected, your gums are bleeding, and you've got cavities and stuff like that, and we can't give you a kidney. And that person just had absolutely no place to go to be able to get the needed dental work done. They were, again, just living off of Social Security. So they applied to our program, and an oral surgeon took some teeth out, and a dentist did some gum treatment and made them some partial dentures and got their mouth all fixed up again, and then they got back onto the kidney transplant list and ended up, as it turns out, getting a kidney. So those are the types of things that we are involved with medicine, but again, dental health and dental work it's such a specifically different non-medical and non-medical insurance and non-Medicare group that's why this became necessary for us to do.
Doc, thanks so much for joining us, and thanks so much for your work here in Rhode Island. I mean, this is so important, and a lot of people will be able to take at least get on that waiting list. And like I said, I kind of alluded to it anecdotally at the beginning of the episode, but I went for a decade without health insurance, and the oral health component of that is really very difficult to maintain when you're not seeing a dentist with any kind of regularity. And, fortunately I was able to navigate it as I guess best an outcome as you could want for the most part. But a lot of people have not been able to do that. So your work is tremendous and we appreciate it. And this is part of an ongoing series here on B-Town, highlighting different aspects of public health in Rhode Island that, we've heard a lot about public health, that's for sure, through obviously the pandemic and the hospital merger and so on and so forth. There are a lot of things happening besides those major stories, and we're glad to highlight yours today.
If there is time for me to mention one more thing,
absolutely, yeah, please.
Our program does have an annual budget, and I specifically this year, we're celebrating what was $7.5 million, what's now $7.7 million. But we could not be up and running without the help of the donations that our own dental association members make, and the match that comes from Delta Dental of Rhode Island. People know that Delta Dental is a large dental benefit company, insurance for dentistry, and we are also celebrating this year a $250,000 worth of donations from Delta Dental of Rhode Island over the past 30 years, which is just a huge celebration of Delta's ability to not only deal with their dental insurance, but to reach out and help the community that doesn't necessarily have a way to be able to even get that dental insurance. And so their $250,000 of donations, and actually allowing us to have an office in the Chusey building of Delta Dental at no charge is really huge. And so the donations from Delta Dental specifically from the very beginning since 1989 have allowed us to be where we are today. And without our sponsors like our dental members and Delta Dental, the Amica Companies Foundation, the Pierre Fauchard Academy Foundation, and June Rockwell Levy Foundation, we just would not be able to operate the program at all. So I thank them for their behind-the-scenes work to be able to allow us to treat the people that we treat.
Yeah, I mean, it always comes down to that. That's the reality of the world we live in, and can't lose sight of the fact that people make things happen through generosity and through sometimes common sense, but generosity is the key ingredient in all of these operations. Doc, thanks so much for your time. We appreciate it a lot.
Thank you very much. I appreciate it.
Rhode Island's podcast of record, B-Town.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.